Hello, my name is Emma Amadrio, and I'm an obstetrician gynecologist with Nakasero Hospital. Today we are going to talk about cesarean section. Cesarean section, commonly known as C-section, is how we usually say the word out there. Cesarean section, C-section. It's a mode of delivery. So cesarean section is delivering a baby through an incision on the anterior abdominal wall. So an incision is a cut. We call it an incision medically. So we cut, and the anterior abdominal wall, in lay terms we say the stomach, but it's not the stomach. What you see is the abdomen or the abdominal wall. So when we make an incision on the anterior abdominal wall to deliver a baby, we call that a cesarean section or a C-section. So a C-section is not something we just do for mothers without intention. There have to be clear intentions as to why we do a cesarean section. And there are some of specific reasons why we do cesarean sections. In Uganda as a country, we have reasons that we call absolute reasons for cesarean section. And that means there are reasons why we do a Caesar and we plan for a cesarean section right in antenatal. We call those absolute indication. An indication is a reason for something. So an absolute indication is one that is not negotiable. So we do a cesarean section for these reasons. The reasons we said were absolute, meaning we don't have any negotiation. In that case, we prefer that you're safely delivered by a cesarean section. And some of the reasons are, if you have already 2 previous Caesars done. In our country as Uganda, when you have 2 previous Caesars, usually say 2 previous scars, will deliver your baby by a cesarean section. If we have the cord coming out before the baby comes out, that condition we call a cord prolapse. It is an immediate indication for a cesarean section. It means the baby is at risk and we need to safely remove that baby before we lose the baby. If there is bleeding before delivery, and bleeding can have some reasons, some of them could be what you call a placenta previa, where the placenta is the one that is bleeding before the baby coming towards the cervix. Or we have what you call a placenta abruption, where the placenta detaches from the uterine wall or from the wall of the uterus. This needs an immediate cesarean section to save the baby, but also to save the mother because of this bleeding. Another reason is fetal distress. In lay terms, we say the baby is getting tired or the baby's heart is getting lower and lower. So when we have a fetal distress, we do a cesarean section to save that baby. And when we have a big baby, in Uganda, a big baby is considered from 4 kgs, 4 kilograms and above. We consider that to be a big baby. There may be some women who may deliver these babies, however, safely delivered through cesarean sections. If we have a baby that is lying transverse meaning the head is on the side and the legs are on the other side, that baby cannot be sent to be delivered vaginally. So we deliver that baby by cesarean section. Those are absolute reasons for doing a cesarean section. And then there are reasons we call relative. Relative meaning that your obstetrician may suggest to you a cesarean section as a safer option, but there are times in some situations where they may allow you progress to deliver. So we call them relative, meaning there may be some room for trial, for negotiation. However, the cesarean section may be a safer option. So in our country, one previous scar or having one previous cesarean section, a mother could try to deliver after having one previous cesarean section. However, we use that as a relative reason to do a cesarean section. And when we have delay of labor or prolonged progress of labor, a cesarean section may be one of the ways to deliver that mother faster. When we have a baby that is in breech presentation, breech presentation is a baby that is the bum is bleeding, or we say the baby is seated in our local way here. So if we have a baby that is presenting that way, a cesarean section may be a safe way to deliver that baby, but some mothers may be able to also deliver these babies vaginally. Then we have hypertensive disorders in pregnancy like preeclampsia as well. This can be a relative indication for a cesarean section. So finally, cesarean section is not without risks. As we said, it's not something we just do out of wanting. There must be a reason we should do a cesarean section, because it's not risk-free. There are complications that come with it. So as Nakasero Hospital, if a mother requires to deliver by cesarean section, we have a well-equipped theater where this can be safely done. We also have very competent teams to do this work, like the anesthesiologist that will make sure anesthesia is safe. We have competent and reliable surgeons, the obstetricians and gynecologists that will do this procedure for you. And you'll have a team of midwives who will receive this baby after being delivered by cesarean section, and the pediatrics team, the neonatologists that will be able to assess this baby after delivery to make sure that the baby is fine. And after your cesarean section, the team on the wards will be midwives that will monitor you for the days after your delivery, be sure that the wound is healing well and you are also fine. So when you need a cesarean section, we'll be able to do it for you safely.